evening, everybody. How are you? And if you celebrate Thanksgiving, happy post-Thanksgiving. Hoping that you had a wonderful moment with your family. Thinking also about the indigenous communities that gave up their land in order for us to feel so grateful in this day and age. It was because of their sacrifice that we are here celebrating and being grateful. I would like to begin by saying how happy I am that we are all in community and how important it is that we talk about diabetes as a disease and a condition that affects a lot of people. It is even more important now because it is the holidays, and we all know it is the season of excess. That means people are going to be eating left, right, and center, things sometimes that they have no business eating in excess. And in my practice, I found that a lot of times there are some misconception about diabetic medication that makes it so that instead of helping you, that medication can actually kill you. I'm not here to scare anybody. It's not a scare tactic, but it is really a moment of reflection and a moment to pass on some information that hopefully moving forward during the season, because we still have not gone through Christmas and New Year's, that we would be a little bit more mindful if we are diabetic, pre-diabetic, or if we have family members or friends that are diabetic, because it doesn't just affect us. If we're not diabetic, thinking, well, I don't have it, so it doesn't affect me. But it might be somebody that you care about that does have the disease, and you could be also their advocate, and you can remind them, that second slice of pie, maybe you shouldn't take it. You're diabetic. I understand that sometimes some of them are stubborn and they just want what they want and they'll eat it. But in a true advocacy role, you can only give the information and assist and be there to support. They make the decision, but at least the information is passed. So I'm going to try to make this short today because we're doing a Zoom, and really this was in response of a lot of questions that I've received, a lot of things that I've seen throughout my practice. And in the past 3 months, I don't know if it's been a coincidence, but a lot of people have asked me pretty much the same question and had the same situation. So I said, you know what? Let me do an information session to go over those medication quickly. I am going to try to avoid using medical jargon. The way I did my slides, there will still be the medical terms there, but I'm going to explain it in like everyday words, like so that everybody can understand, because that's the point. Sometimes the medical jargon does not help. So let me start by sharing my screen. And if at any moment you guys have questions, do not hesitate to stop me, either raise your hand or ask your question, and I will try to answer as good as possible. Here we go. All right, everybody sees my screen. Oh, I can't see you guys anymore because I'm sharing my screen. Okay. If you don't, just let us know. So diabetes, medication, therapeutic, or toxic. So we're going to talk about, well, first of all, what is diabetes? We're going to go over the symptoms. We're going to then jump into the um, medications, the different types of medications for diabetes. And we're going to explain the medication. Really, I'm going to go over it by posing the myth and reality. The myth that I've seen are the most common that I've seen throughout my career. Okay, so diabetes. What is diabetes? How would you describe diabetes? Diabetes, if you look at the description in the dictionary, It is described as a chronic disease that's characterized by the body's inability to properly produce or to use insulin, leading to elevated blood sugar levels. I will go even further because diabetes is not just the blood sugar being high. What makes diabetes deadly and what prevents you from controlling it and truly put that disease in all its splendor is the fact that we cannot maintain that blood sugar at a therapeutic level. We either go too high or too low, and the inability of maintaining the blood sugar, this is what makes it really difficult. So, the symptoms to recognize diabetes. And this is not so that every time you feel tired, you think, oh my gosh, do I have diabetes? But if there is a suspicion of diabetes, this can help. And if you have people that you know do suffer from diabetes, as a non-diabetic, it's good to know also because you might be the one who recognized the symptoms and you might be the one to help. And don't underestimate your help when it is done for a diabetic because ignoring it may lead to the blood sugar being too high or too low. So it could lead to a diabetic coma. So feeling tired, feeling weak, one symptom, irritable, and having mood change. And a lot of time we say, like we all have friends. I know I'm one because I'm pre-diabetic. That people will tell me, "Oh, you're getting hangry." Hungry and angry. When I'm hungry, I am just not somebody you want to mess with. I will chop anybody's head off because I'm hungry. Well, that's not good. That's because my blood sugar goes too low and then I get irritable, so it affects the mood change. So it's funny sometimes it becomes a joke when we're saying, "Oh, so and so, you're hungry, you're hangry, you must be hungry." But let's try to dig a little further and sometimes I go like, have you ever gotten your blood sugar checked to see if you're not pre-diabetic? Because it might be a symptom. Having blurred vision is something also that we don't take seriously sometimes. And when the vision get blurry, we think that, oh, maybe I just need glasses. Oh, um, I'm just tired. But that is a sign of either high or low blood sugar. Urination often, meaning you void, you go to the bathroom to pee more often than usual. That is another sign that your blood sugar might be too high. Um, and this goes hand in hand with feeling more thirsty than usual. So because you are going to the bathroom more often, you're dehydrating. And a lot of times we'll think, oh, it's just dehydration, but it could be also a sign that you are diabetic or pre-diabetic. Presence of ketones in urine. Um, that one, um, that one is for further down the line for diabetes. It's not one of the first symptoms that you'll see. Um, Getting lots of infections, such as gum infections. You get a lot of canker sores, skin infection, and vaginal infection. For women, yeast infection. That might be something that might make you want to. If you're hearing somebody coughing, it's my mom in the background. I'm at my parents' house. Yes, for women, vaginal infection is might be a sign that your blood sugar is probably too high. And having slow healing sores, again, they go hand in hand. So you may have wounds that usually a simple scratch, will heal in a couple of days. And for some reason, that scratch becomes infected and it takes forever to heal. Might be a good idea to check to see how is your blood sugar behaving. All right, let's get into the nitty-gritty of it. Um, I'm doing this because how many times have I heard that I'm taking my medication, I don't understand why I'm feeling this way or that way. And that is because when the people go to see their healthcare providers, from the doctor to the time that they get home, there has not been somebody who sits them down and explain to them how the medication is going to work and how they are supposed to take it. So that's what we're going to do right now. There are three types of diabetic medication. You have the oral medication, which are the pills. You are the injectable insulin. So that's the insulin, the shots that they give themselves. And then you have non-insulin injectables. So those are shots too, but it's not insulin. And in those categories, that's where you find the Mounjaro, that's where you find the Ozempic, those medications that are the new craze now. Those are the non-insulin injectable. So let's begin with the oral medication. The way the oral medication works, it is either gonna it's either gonna stop the blood sugar from being produced in the liver. Just one moment, please. Where am I? Or you are going to stimulate the. Can you guys mute it, please? Mute, fermez le micro, s'il vous plaît. Yeah, yeah. Oh, you're gonna have our type of medication that are gonna stimulate your pancreas to produce more insulin. You have medication that are going to hinder the reabsorption in the kidneys, and you have other medications that targets the hormones. So those are the oral medication. This is how the oral medications work. Then you have the injectable medications, which are the insulin. So you have the rapid acting insulin. That's the one that is fast. The long acting insulin, that's the one that's slow. Intermediate acting insulin, it's in between, the word says it. And then the premix, sometimes the doctors will order some customized premixed insulin. And the non-insulin injectable, you'll find that a lot of times it is a once a week or once a month type of injectables. And those are the ones that are the Mounjaro, the Ozempic. And the way these medications work, they stimulate the insulin release and they slow down the digestion. That's why those medication has the side effect of cutting appetite, and you see that people who are on Ozempic or Mounjaro or those type of medication tell you, I even forget to eat. I'm never hungry. It suppresses my appetite. That's because that's the direct action of the medication, is to slow down the emptying of the stomach. So with the oral medication, the myth, what I hear a lot of time people saying is, I can take my medication at any time of the day as long as I take it the way the doctor told me. So if the doctor said you are going to be on, I'm going to take an example, metformin. Take your metformin once a day. Okay, it stops there. And it's not a joke. It really stops there. It's not all providers. Some doctors will take the time to go into more details, but I found that a lot of times they just tell them, and that's because that's their job. I'm going to put you on a medication, put you on metformin, let's say, and you just take it once a day. Just make sure that you take it once a day, and that should be okay to regulate your blood sugar. And they will go over the signs of high and low blood sugar and tell them how to recognize them, and don't go into the details. And why the detail is important is because those medications in general, takes about 20 to 30 minutes to get in your system. Once it gets in your system, that's when you're going to start to see the action of the medication. So if you're taking your blood sugar medication and nobody told you that you have to take it 20 to 30 minutes before you eat or with food, that can be dangerous, because in 20 to 30 minutes, that medication is going to start to peak. So that means it's going to either release a lot of insulin, uh, or lower your blood sugar in your bloodstream. And if you did not take it with food and you take it in the morning, you just spent 8 to 12 hours sleeping. That means you were fasting. Your blood sugar is already on the low side, unless you are like a brittle diabetic. It's already on the low side. And if you're on pills, most likely you're not going to be brittle. You're a beginner. You take that medication, guess what happens? Your blood sugar is going to drop. Now, pair this with somebody who's not familiar with the signs and symptoms of low blood sugar. It calls for disaster. Take somebody who is getting ready to go to work in the morning and they take their medication and they get ready to go and they don't have their breakfast. Papi, pardon me. They don't have their, they did not eat their breakfast. Therefore, their blood sugar is already low. Now they get in the car and they're driving to go to work. And that's when the medication's action hits. It's supposed to be the therapeutic action. It's supposed to be the intended effect. But if there's nothing in the body to lower, it's already low, that person may go into hypoglycemic, which means blood sugar goes down. And it could go from blurred vision to feeling sick, feeling dizzy, to passing out. When you hear sometimes that somebody had like a really weird car accident and come to find out it's because their blood sugar was high or low, but usually low, and they passed out while they were driving. So that's why it's important to know, let's say oral medication, 90% of the time when it's blood sugar medication, you have to take it with food, with a meal. If you read the instructions on that the pharmacy gives you, usually they give more details there. But how many people read those instructions? Usually we jump straight to the side effects. You also have to read the instructions. So with the diabetic medication, the oral medication, so the pills, those are the metformin, the glyphosate. You have to take it with medication to make sure that it keeps your blood sugar level. What it helps to do is suppress the spike, but if you don't eat and your blood sugar is already on the downside and you take the medication, you're going to go too low. So that's something to keep in mind. So I went over this while I was talking. So it is very important that you establish a schedule when you take your medication. So if you take it in the morning, 9 o'clock in the morning, try to always maintain the same time, because then you have a therapeutic level in your bloodstream that is maintained. It doesn't go up and down and up and down. Be mindful of activity level and food intake when you take those medication. Again, when you work out, let's say you say, okay, I'm going to get on the ball. I am going to take my medication, but I'm going to be careful with what I eat and I'm going to start exercising too. The good intention is there. But if you don't know that you must eat before you go start that workout, you will be like a pancake. You'll flat out during the workout. Your blood sugar is going to dip. And if you take oral medication on top of that and you did not eat anything, you're not going to do yourself a service. It's not going to be like, oh, if I don't take my blood sugar medication and I go work out, I'm going to burn even more sugar in my bloodstream. No, 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 no. It's going to go low, and then you're going to pass out. So you have to be mindful. If you take your medication, you have to eat and see where you can put your session of exercise so that at least you have enough energy to do it. If you experience anything out of the ordinary, very important that you tell your provider, tell your doctor. We are quick to criticize the doctors. They didn't tell me this, they didn't tell me that. But a lot of times we withhold information also. We feel like they're going to frown if you share certain symptoms because you've known. No, it's supposed to be a relationship with your provider. And a lot of time people feel like the doctor's here and they're giving information to you. No, it is not. They are here to provide a service, but you have to be an advocate for yourself And you also have to remind them that they are there to serve you. So if you have questions, you must ask them. If you feel there's something different, you have to let them know. That way, they can assess you accurately also and know what to do next. And we are also having the MIND program, which is a program that's with Origin Foundation. And it is there to be an advocacy for people. It is there as a support care program. So if you have questions, we are there also to answer minor questions. A lot of time, I refer people back to their providers when they need to know things that are a little bit more detailed, that it would be out of our scope, then we reorient them towards their provider. But questions like, when am I supposed to take my medication? What does this medication do? That we can help with. Second one, insulin, the injectables insulin. Myth. If I get $1 for the amount of times that I heard my diabetics tell me, oh, it's a party, and this is because it's the holidays, so you're going to hear that even more from the diabetics. Oh my God, you made some pineapple upside down cake. Oh my God, look at that corn souffle, this, and that, the spread, the food, it looks so good, the sweet potato pie. Oh, and then somebody will remind you, aren't you diabetic? Girl, please, I'll just take my injection. I'll be okay. Ah, 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 ah. That is the mistake. That is what people do all the time. And that's why their condition worsen. What you want is to control and maintain. You do not want to throw your body off in spikes because you think that the injection is a crutch. So, therefore, what you need to do is to first be mindful of your nutrition and understand again how the medication works. Yes, when you take injectable, example, rapid insulin, Novolog, regular insulin, those are going in your fatty tissue. They use the needle, you take the amount of units you need, and then it's in the fatty area. So not here where the muscle is, but underneath, right there where the chunky part is, or around your abdomen, or your thigh, where you have more fat, because it is absorbed better in fat. And when you take the regular insulin, this will start acting like within minutes because it's right there in your system. It goes, it's soluble, it's going to be soluble in the fat and get in the bloodstream extremely fast. So this is one that don't don't wait um, once you take it to eat. Eat within 15 minutes of taking your regular insulin. So the typical sequence when you take insulin or when you give insulin to a loved one is you check the blood sugar first. So you do the finger stick, or now they have those monitors that stay there and then you can look at the reading on your phone. You check your blood sugar. Blood sugar reads 70. So then you don't need insulin regular. It depends on the sliding scale that the doctor has prescribed, but usually when it's below 100, you don't need any insulin. If you do need insulin, let's say you check your blood sugar and it's 200, you need you need insulin. Then you'll have time to prepare your insulin, give yourself your injection, and then eat. Don't check your blood sugar after you had a huge meal because it takes about 2 hours to digest and for your blood sugar to go back to normal. So if you check your blood sugar after having a huge meal, your blood sugar may be 300, 400. And then you're going to give yourself massive dose of rapid insulin and throw your body in spikes. No, you check it before and then you have a sensible meal. You don't abuse your body. Same thing with the slow acting insulin. Slow acting insulin like Lantus or Novolog L. Novolog L, yes. Those are medication that takes 8 to 12 hours to act in your system. You'll find that a lot of time the providers will either give you one injection in the morning or, and depends how bad you are, one injection in the evening before you go to sleep. Now, if it's in the evening, and this is where I've seen a lot of people wake up in the morning and shaking, is because while you're sleeping, you're not eating, unless you don't sleep and you eat overnight. But while you're sleeping, you're not eating, and but the medication that you gave yourself is still acting in your system. So by the time you wake up in the morning, your blood sugar should be in the normal range. A lot of times people will wake up with their blood sugar being a little lower. So they'll wake up and they feel shaky. So it's a good idea before you go to sleep, if you take any type of insulin, to take a little snack. And the snack is not cookies and creams, not the Oreo. It would be best to take a snack that is higher in protein so that you can digest it slower in your body and it won't cause any spike of blood sugar while you're sleeping. But at least in the morning when you wake up, your blood sugar won't be too low. Okay, those are the two main ones. The combination insulin, that really has to do with the doctor and to see if you need it. And usually it's when you're brittle diabetic that they do that. Any questions? I'm going. Anybody has any question?
None right now.
Not so far? Okay, so let me continue. So as I said before, with insulin injection, you must check your blood sugar levels when taking rapid acting insulin before you give yourself the insulin. The medication is administered in the fat layer of the body because it absorbs better there. Rotate the site of injections. Yes, I did not talk about that. When you give yourself insulin or you give a loved one insulin, don't just stay in one site. Don't just give yourself insulin here or just around your belly, but just in one site. It's going to end up ulcerating and you're going to end up having sores there. And then it's going to create kind of like scar tissues where when you inject, you put the needle in, you start feeling like it's popcorn. When it goes in, that's because it's creating scar tissues. So rotate the site. So you can give one time here, one time there, one time here, one time there. Just change the site, alternate when you give yourself insulin. Again, when taking long-acting insulin, pay attention to your blood sugar dips. So pay attention to see, is it after 6 hours? Is it after 8 hours that I took the long-acting insulin that now I can feel or I know that my blood sugar is going low? That'll give you a good indication of, let's say at night, when to take your snack, or if you take it in the morning and you know that by 6 o'clock, I need to eat something and my dinner time is no later than 6 because that's when that long-acting insulin is really going to kick in. And the last pup in there, the myth with Ozempic, Mounjaro, Trulicity, Victoza, all those medications, those new flavor of the month right now, is that, and and I hate it when they do that, but they do that in the commercial. They'll be like, you don't have to change your lifestyle. Do not change your lifestyle. Just take a shot a day. No, 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 no. First of all, you should have a healthy lifestyle regardless. But if you are pre-diabetic or diabetic, and you should really be taking those injections when you're diabetic. Now, because of the side effect of these medication is weight loss. So now it's being used for weight management. You have to take really close eyes on your liver function, your kidney function when you're on those medication. And it is highly, highly recommended. To me, I think it should be mandatory before even prescribing those medication, making sure that the patient, the person that's going to be taking them, understand that they have to be discipline and they have to be careful with their nutrition and have some form of exercise in their routine because these medications they're not there to replace bad lifestyle. They're here to assist you into adopting a better lifestyle and then getting to your therapeutic numbers. So thinking that you're going to continue the same lifestyle, not doing exercise, and not having a sensible nutrition, and that medication is going to solve everything is not true. It will, for the moment that you take it, you'll see some result. And this is where it fools you because you're thinking, I didn't have to do any change. And look at that. I'm dropping the pounds. My numbers are good. My, what they call hemoglobin A1C, which is the indicator of how your blood sugar has been behaving in 3 month span, all of a sudden it's going down. Ooh, 6, ooh, 5, ooh, 4. I'm good. But one, especially if you're in the US, I don't know about the other countries, so I can't pronounce myself on that. But the US, those little suckers are expensive. Unless you have insurance that covers it, like really covers it. Can you afford 600, 700 per pen? And when you can't afford it anymore, when because we've seen it, this is like normal practice, the insurance will cover it. And then after that, they decide to drop. They decide they're not going to cover Ozempic anymore. And now you're stuck because that medication was your miracle medication. And now your insurance doesn't cover it anymore. So the doctor has to go back maybe to the other methods that they used to take. But guess what? Now that medication messed up your system because the effect that it was supposed to have is to slow down your stomach from emptying. Therefore, you forget when to eat. You can go hours without eating. You are literally fasting because of the medication, suppress your appetite, and now you have to get back on a more healthy routine because if you don't, you gain all the weight and your numbers are going to go back to what they were pre Ozempic, Manjaro, Trulicity. So my recommendation, my advice is that even if you are prescribed those medications, maintain a healthy lifestyle or work to get onto the path of a healthy lifestyle. That means sensible nutrition and do include physical activity in your life. That means walking. You don't have to be like overdoing it, being extra. No, just starting to walk is enough to say at least I begin because at least your muscles will be moving and burning. Start doing that so that if if you have to get off those medications for whatever reason, you are not going to go back to square one. So just a recap of what I said, they are more effective when combined with healthy eating and regular physical activity. So I'm not saying that those medication are the devil. Anybody who's close to me will hear me say that sometimes, but they have their place. They do have their place. If everything has been tried, everything has been done, and this is what's going to help you control your diabetes, control your numbers, so be it. But you have to put all the chances on your side. They are there to slow down the gastric emptying. That means your stomach empties much more slower, and the absorption of other drugs is slower as well. They may cause reduce food intake because you're not hungry anymore. Um, and that though can lead to you feeling fatigue and not having as much calorie intake that you need. So you feel a little low. And one thing that you have to be careful with those medication is gastroparesis. There's a word that I should have put on the on the list. Gastroparesis, which is the slowing down of your stomach, but to the point that it almost paralyzes your stomach. So that means that now your stomach does not absorb anymore. your stomach does not do what it's supposed to do to push the food down to the intestine. And then your stomach has to be pumped basically, and you have to be on medication for that. So this is a side effect
Excuse
also of
me,
those medication. Yes,
this is the
I'm going too
interpreter. I
fast?
apologize. Could you please repeat the point on the gastroparesis? Paralysis?
Yes,
Thank you so much.
yes, yes. So, gastroparesis is a condition where the stomach slows down so much that it almost paralyzes the stomach. So it doesn't fulfill the what it's supposed to do. So one, it's supposed to secrete acid in order to digest foods. It's not doing it because it's paralyzed. And two, the stomach is supposed to be contracting and releasing to push food towards the intestine so that it continues to do its merry way and get all the way down to your rectum. Well, if the stomach doesn't work, then the food stays there. And that is what gastroparesis is your stomach slowing down to the point of paralysis. So what I would tell people, what I always repeat people, is that you should become best friend with your healthcare provider. You build yourself a support system, and that include family, friends, people around that you can talk to, that it's a safe space where you can, share with them. But in all jokes aside and being really serious, you need to be best friend with your healthcare provider. This is why it is important to pick a provider, that it is a doctor or a nurse practitioner or a DO, a doctor in osteopathy, is to make sure that you're comfortable to share with them, and honestly share with them so that they can actually help you. You should not hesitate to call their office if you have questions. I understand a lot of time when you go see the doctor, and they all the medical jargon to you, and that may be a little overwhelming, and you can't think about any question right at that moment. You should make it a point to feel comfortable enough that if, let's say, you get home and that's when a question pops up, pick up that phone and call that doctor's office. And somebody from that doctor's office should be available to answer your question, either right there on the phone, or they call you back within a, acceptable time length in order to address your question. If your doctor's office or nurse practitioner, your provider does not do that, it's time to change. Because unless we are advocate ourselves for our health, you can't hold them accountable. So you have to be able to call and be able to get the information you want. But the other side of the coin is that they have to follow up with you. If, let's say, you speak Haitian Creole or you speak Spanish and you feel like you won't get the information that you need, and it's not important. It's just really something minor that I just need to know. It's a detail I need to understand. Guess what? You can call us at the Mind Program. This is what we are building, literally. You become a member and you register for the Mind Program, and then we will be able to help support you. It's literally the team of professionals that got together, decided that it was supposed to be a space to support people in their care, not taking the place of the provider. No, we don't. Because if those are questions that go beyond our scope of practice, we do refer you back to your provider. But if it's something that we can help you with, if it's a question that you have on physical activity, um, when would be the best time for me to exercise? What exercise can I do? If I weight lift, is it too violent if I'm diabetic? Am I gonna go down too fast? Guess what? We have a personal trainer on board, Micah, that can help. If it's because your stress level is way up there, and a lot of times we underestimate how stress can act on our body in general, blood sugar included, and you feel like You probably need to talk to somebody to help you relax, or helps you find certain points that needs to be get a deep tissue massage, and that helps you relax, and hence then probably have more clarity to face whatever problem you have with your diabetes. We have Aji, she's a massage therapist. You don't want to go through a conventional doctor. I don't trust that system. Okay, that's fine. I don't trust it either. And I've worked in it for 26 years. Probably why I don't. But we have clinical herbalists that are there. So this is, I don't want to say it's the alternate, because it's not the alternate medicine. It's actually the medicine. That's what was there. Excuse me, I'm speeding. That's what was there before modern medicine. And you have questions about nutrition, we are now bringing in, well, the person was volunteered, but we are going to get it official, a certified nutritionist to help you with, what can I eat, what cannot eat, potatoes versus sweet potatoes, complex carbs, simple carb, which one is best? That can be answered. So, yeah, that's a lot of things to take in. This brings me to the end of, oh my goodness, I did do an hour. Okay. Um, of the presentation. We always record all of our presentation and then we upload them to YouTube. So if you have things that you feel like you missed, you can always go back and listen to them. If you have questions, please don't hesitate to reach out to us. And hopefully, when we do those presentations, it lights up a spark somewhere and we help to educate, because this is the mission of Origin Foundation, is to address the disparities. And one of the main factors is the lack of information that leads to the lack of education. So I hope that I helped you with certain questions on diabetes and the medications and how to take them and what they are there for, especially during that time of the year when we know that there's going to be excess. We are humans. We like to celebrate among each other, and we don't want to be the Debbie Downer, and we don't want to miss out sometimes, but we have to think about our health, and we have to be um, present for people around us also, not just us personally, but the people that we love that, maybe diabetic or pre-diabetic. So I hope I helped. If there's any questions, you can put them in the chat. I'm going to stop sharing my screen. There you go. All right. Or you can just open your mic, and any comments, questions, anything that crosses your mind that you want to share, don't hesitate.
I put the link of the Mind program on the chat group.
Okay, thank you. All right. It's either I was crystal clear or you guys, or I scared everybody to death. Um, so I am going to close on this. I want to say a special thank you to the interpreters. Um, between Debbie, Luisis, Maria Angelica, and Adil for having my back for the past year. We want to make sure that the information is accessible, and language a lot of time is the barrier. And we don't think about it. We don't think to have spaces that are inclusive for everybody that speaks different languages. And we are a lot of time putting English as the main language and not taking into account that people would be more engaged in exchanging and talking and being more active if they felt like they were heard, and that there was space for them. And that's what we want to do by including different languages. And the interpreters have been able to provide this for Origin with our monthly meeting. I want to thank ASC also for always being there. as AV support for us. This month we did it only by Zoom, but usually we do it in a space. And that space is the Southern Alchemy Wellness. And the owner, Tracy, is a wonderful person that opened the doors to her boutique in order to have the monthly gathering. So everybody that supports our mission and our movement, I want to say thank you from the bottom of my heart. I may not celebrate Thanksgiving the traditional way that is being done in the US, but showing gratitude is something that we should do every day. And I'll just take this opportunity, since it's the Friday after the Thanksgiving, to express our very deep gratitude for your help. You guys have a beautiful Friday, beautiful rest of the weekend. Have fun and be kind to one another and think about each other if there's any high blood sugar. All right, guys. Bye.